Let's delve into the overview of the cranial nerves. What are the cranial nerves? A number of cranial nerves send electrical signals between your brain and different parts of your neck, head, and torso. These signals help you smell, taste, hear, and move your facial muscles. The cranial nerves begin toward the back of your brain. They are a key part of your nervous system. How many cranial nerves are there? You have 12 cranial nerve pairs. Each nerve pair splits to serve the two sides of your brain and body. For example, you have one pair of olfactory nerves. One olfactory nerve is on the left side of your brain, and one is on the right side of your brain. What are the types of cranial nerves? Your 12 cranial nerves each have a specific function. Experts categorize the cranial nerves based on number and function. Cranial nerve 1 is the olfactory nerve, the sense of smell. Cranial nerve 2 is optic nerve, ability to see. Cranial nerve 3 is the oculomotor nerve, the ability to move and blink your eyes. Cranial nerve 4, trochlear nerve, ability to move your eyes up and down or back and forth. Cranial nerve 5 is the trigeminal nerve, sensations in your face and cheeks, taste and jaw movements. Cranial nerve 6 is the abducens nerve, the ability to move your eyes. Cranial nerve 7 is the facial nerve, facial expressions and sense of taste. Cranial nerve 8 is the auditory vestibular nerve, sense of hearing and balance. Cranial nerve 9 is the glossopharyngeal nerve, the ability to taste and swallow. Cranial nerve 10 is the vagus nerve, digestion and heart rate. Cranial nerve 11 is the accessory nerve or spinal accessory nerve, shoulder and neck muscle movement. Cranial nerve 12 is the hypoglossal nerve, the ability to move your tongue. Now, what conditions and disorders affect your cranial nerves? Some conditions or injuries can damage parts of the brain where cranial nerves are located. In some cases, a condition may damage only one cranial nerve. Trauma or surgery could injure or sever a nerve. Disorders that affect the cranial nerves include: Number 1. Amyotrophic lateral sclerosis, ALS, a progressive disorder where nerve cells break down and muscles weaken. The 5th, 7th, 9th, 10th, and 12th cranial nerve nuclei are frequently involved in ALS, as of course are motor neurons in the spinal cord. The proximity of the 5th, 7th, 10th, and 12th nerves to the CSF is illustrated. Number 2. Bell's palsy, sudden muscle weakness, and drooping in one half of your face. This condition results from damage to the facial nerve, the 7th cranial nerve. Number 3. Hemifacial spasm, involuntary contractions, twitches on one side of your face. Hemifacial spasm, HFS, is characterized by paroxysmal, involuntary twitching of facial muscles on one side of the face innervated by the ipsilateral facial nerve, 7th cranial nerve. The abnormal involuntary firing of the peripheral facial nerve triggers short or longer contractions of muscles of facial expression. Number 4. Internuclear ophthalmoplegia, loss of ability to move your eyes in sync when you look to the side. Internuclear ophthalmoplegia or ophthalmoparesis, INO, is an ocular movement disorder that presents as an inability to perform conjugate lateral gaze, and ophthalmoplegia due to damage to the interneuron between two nuclei of cranial nerves 6 and 3, internuclear. Number 5. Oculomotor palsy, damage to your 3rd cranial nerve that causes one of your eyes to stay positioned as though you are looking down and out to the side. Number 6. Stroke, interruption to blood supply in your brain because of a blood clot or ruptured, burst, blood vessel. Traumatic brain injury, disruption or damage to brain function, often because of a sudden and violent blow to the head. Acute brainstem stroke can present with isolated oculomotor palsy, and because the 3rd cranial nerve nucleus is the largest, it is more prone to ischemic injury, hence the relatively higher risk of recurrent stroke in the first year. While the 6th cranial nerve can be damaged by infection, a stroke or tumor, increased pressure in the brain, and even migraines. Last but not least, the trigeminal neuralgia, chronic pain in your 5th cranial nerve which runs through your cheek.